you're looking to dive into topics on how to live a happier, healthier, more fit, and long lifespan, then you've come to the right podcast. Livin the Dream with me, Coach Damian Evans. Together, we will explore the topics on all things health, fitness, and wellness. Together, we will be lifelong learners on this journey to living the ultimate dream. What up, Dream Team? Coach D here, coming at you from beautiful sunny San Diego. And in today's Megaphone episode, we will be shouting out one of the most informative people to follow on social media that I know about that specializes in powerlifting and biomechanics and injury prevention, as well as physical therapy. His Instagram handle is at Squat University, and his name is Dr. Aaron Horschig. As a physical therapist and a strength coach, Dr. Aaron Horschig helps athletes move better, decrease their aches and pains associated with training, and find their true athletic potential. After spending over a decade competing in the sport of Olympic lifting, even placing 6th in the 2011 USA Nationals, Aaron knows firsthand the struggles and injuries that athletes face in their pursuit of lifting big weights. Dr. Horschig founded Squat University as a way to share his innovative approach to help millions of athletes and coaches across the world move better, decrease their aches and pains, and reach their true athletic potential. He has worked with some of the best athletes in the world, including elite powerlifters and weightlifters, as well as athletes from the NFL, MLB, and international level soccer players. Dr. Horschig wrote an extremely informative and also controversial article that I love and that I want to share. This information and this article addresses a well-known injury protocol, a protocol that I used very frequently when I was an athlete in high school and in college, a protocol that I used with clients and family members of mine that have got injured in the past, a protocol that I believed in wholeheartedly, and I taught it every chance that I could anytime someone asked me about an injury. A protocol that my college courses taught me straight out of the textbooks. It was simple. When you get hurt, the solution is RICE. R-I-C-E. Rest, ice, compression, and elevation. We all knew about RICE. And it turns out we were all wrong. The article is titled, "Don't Ice, Walk It Off." What I'm going to say to you might shock you. It might even anger some of you. It did me. The statement I'm going to make flies in the face of what many of us and the people in the medical field have been preaching for decades. But it's something that you need to hear. You need to stop icing on injuries and sore muscles. Stop using ice on injuries and sore muscles. Now, before you throw your hands up in disbelief and scream at the top of your lungs how ridiculous this statement is, hear me out. Ice is not what you think it is. It is not helping the healing process from injury. And in fact, an overwhelming amount of research shows it does the opposite. What? The opposite? I'm going to throw a tantrum. Other than temporarily numbing the sensation of pain, ice delays healing and recovery. Ice delays healing and recovery. But before you take my word for it, let's take a deep dive into the history of icing and why its use became quote unquote conventional wisdom. From a young age, we're taught that if something hurts, you put ice on it. If you sprain an ankle at a soccer practice, wrapping a bag of ice tightly around the injured area is the first step to feeling better. We do this because we've been told icing helps reduce harmful inflammation, and it helps swelling, and it even helps to kickstart the recovery process after intense workouts. It's not uncommon today to see the best athletes in the world doing post-game interviews with huge bags of ice wrapped around their knees, their shoulders, everywhere. But with a simple Google search, you can easily find photos of Michael Jordan with ice on both knees after an amazing game that he had. Of course, we all had to start using ice after seeing that. As the saying goes, we all wanted to be like Mike. As a competitive weightlifter, Dr. Horschig commonly used ice on his sore knees. He used it on his back after intense training sessions. He was told that this was a normal part of being a strength athlete. He would even jump in an ice bath after an intense squat session to help kickstart the recovery process. Or at least that's what he thought he was doing. In the rehabilitation world, physical therapists, athletic trainers, chiropractors, they use ice every day in clinics and training rooms across the world. In his early career as a physical therapist, it wasn't uncommon that every one of his patients would get a cold pack wrapped tightly around their injury after their rehab session. However, the profession that has been using ice the longest is the medical field. Published articles dating back to the early 1940s explain that doctors would commonly use ice to help decrease infection rates, block pain, and reduce the rate of dying on the operating table during amputation surgeries. This is because ice slows down cellular metabolism. That's important. Ice slows down cellular metabolism. So this allows surgeons to keep as much muscle tissue alive as possible. While usage of ice medically was originally intended to preserve severed limbs and decrease complications in the operating room, but it would eventually slowly sneak its way into being used for all injuries. In 1978, Harvard physician Dr. Gabe Merkin, he coined the term RICE, rest, ice, compression, and elevation. This was the recommended treatment for sports injuries in his landmark book, The Sports Medicine Book. Since this time, the medical community has religiously used this protocol for the treatment of all acute injuries. Now, if you were to ask a medical doctor today, why do you use ice? Why do you recommend ice for the common ankle sprain, backache? And you know what they'll say? They're going to say that it helps alleviate pain, it helps to reduce inflammation, and it restricts swelling. In fact, this is why some surgeons insist that their patients use ice for months on end after surgery. If literally everyone is using ice, how are we so wrong about it? How can it be the wrong thing? Well, there's no denying that ice provides temporary pain relief. That's what it does the best. Slap an ice pack on your body on a part that is in pain, and instantly you're going to start feeling better. In fact, if you look at the scientific research, the use of ice, called cryotherapy, a reduction of pain is the number one benefit of cryotherapy. But here's the deal. Just because pain is decreased does not mean that you're fixing the injury. In fact, could it possibly mean that maybe you're doing more harm than good? I don't know, but does that ring a bell? Short-term relief that masks a certain feeling? What else do we currently do in our life that does that? What may blow your mind is that Dr. Gabe Merkin, the guy who invented the RICE protocol, he actually came out in 2013, almost a decade ago, in the foreword to his second edition of his book, and he called this book Iced, the illusionary treatment option. And he withdrew his original statement. Admittedly, he wrote, quote, "Subsequent research shows that ice can actually delay recovery. Mild movement helps tissue to heal faster. Mild movement helps tissue to heal faster. And the application of cold suppresses the immune response that starts and actually hastens recovery. Icing does help suppress pain, but athletes are usually far more interested in returning as quick as possible to the playing field than reducing pain. So today, RICE is not the preferred treatment for an acute athletic injury. Whoa, the guy that invented RICE came out later saying that movement is actually better for recovery than ice. I hope by now that I've caught your attention. Let's dive deep into how ice actually affects the body. And we're going to start with inflammation and swelling. Inflammation and swelling. We've always been told that inflammation and swelling are bad things. These things that we need to stop as soon as possible. And I'm here to tell you that today that these things are actually not bad things. In fact, inflammation and swelling are normal responses to injury and a part of the healing process. If you ask any medical professional, what are the 3 phases of healing, they'll tell you the same thing. It's inflammation first, repair second, and remodel third. Inflammation, repair, and remodel. If you don't believe me, check any medical text. You'll find the same answer. Inflammation is the first stage. This is the first stage of the healing process, no matter what location it is on your body, the severity of the injury, whatever. It's the first stage. If this is a normal response to injury, why do we want to prevent it? When injury occurs, such as a sprained ankle, inflammatory cells called white blood cells naturally rush to the site of pain to kickstart the healing process. Specifically, tiny cells called neutrophils are deployed to destroy bacteria. And this is especially the case if there's an open wound. And other things called macrophages come to remove the damaged tissue cells caused by initial trauma. Now, macrophages, you might remember from your physiology class, these are like little Pac-Man swarming things that come in and chomp down and consume all the little tiny, well, in the Pac-Man case, it's dots, but in this case, it's the cells that died off due to the initial trauma. At the same time, these cells also release an anabolic hormone. Anabolic means to build. This hormone is called insulin-like growth factor, or IGF-1. IGF-1 goes into the surrounding area that sparks the next phase of the healing process. First inflammation, then muscle repair, and finally regeneration. Plain and simple, healing requires inflammation. It's an essential biological response following an injury. It isn't a bad thing, like you've been told your entire life, like I've been told my entire life. While chronic levels of inflammation can clearly play a role in certain diseases, such as autoimmune disorders or things like rheumatoid arthritis or lupus, it is extremely beneficial to muscle regeneration directly after an acute muscle injury. In fact, a lack of inflammation actually blunts the healing process, and it contributes to poor muscle regeneration. This blunting of the healing process occurs when you use ice. So placing ice on an injury essentially places a roadblock in front of the white blood cells that are trying to get to the injured area. And this stunts the natural inflammation process from occurring. While you think you're helping the healing process by placing this bag of ice on your body, you're actually delaying it from ever starting by preventing the body from doing what it wants and needs to do. So think about it like this. Here's an analogy. A car accident just occurred on I-5 on the highway, and there's debris, there's shattered glass, shards of metal, just stuff everywhere. 911. You call 911 and now it's an emergency. Vehicles are on their way. All of a sudden, a barricade is put up right in the middle of the highway, putting an immediate halt to all incoming traffic. What do you think is going to happen to those people that are involved in the accident, sprawled out in the highway down the road? Well, the ever important white blood cells or emergency vehicles, with the sole purpose of getting to that site and cleaning up the damaged tissue, those things are not going to arrive on time. And the production of IGF-1, whose job it is to spark muscle repair and muscle regeneration, this is going to be delayed as well. And to make matters even worse, pressing the pause button on this process ultimately restricts blood flow to the surrounding healthy tissue areas, leading to additional cellular damage on top of the initial injury. Talk about adding insult to injury. And I know what some of y'all may be thinking, but what about the swelling? Swelling, isn't ice great for that? You got to get the swelling down. Well, if you ask any medical doctor why they use ice for swelling, the doctor's probably going to likely tell you that it's because excessive swelling can lead to increased pain. Swelling can lead to decreased range of motion, and swelling can lead to lengthen the recovery time, which this is actually true. If swelling is allowed to stay in a joint, it can have negative effects. However, swelling isn't a good thing or a bad thing. It's simply the end response of the inflammatory cycle. It's what we do about that swelling that makes all the difference. You see, following an injury, the surrounding blood vessels, they dilate as part of the inflammatory response. And the small capillaries surrounding the damaged tissue, they all open up a little bit wider. And they do this to allow white blood cells to arrive and do what they need to do. This rush of white blood cells out of the capillaries also pulls additional fluid into the surrounding tissue. We call this accumulation of fluid swelling. Swelling, however, is there for a reason. It contains the waste byproduct of the initial damaged tissue. So the firemen, the ambulance, the policemen, they've all arrived to the site of the crash. They begin by cleaning everything up, getting all the damage repaired, and they need a way to remove it from the road. Unfortunately, the additional fluid that now contains waste, metabolic waste, it can't leave the same way that it came in, through the circulatory system, through the blood, veins, and arteries. It has to be evacuated through an intricate network of vessels that we've talked about before, just a little bit. This intricate network of vessels in your body is called the lymphatic system. The lymphatic system, your waste management system. You see, your body has a few different pathways to move fluid from place to place. Your circulatory system, arteries and veins, pump blood cells and fluid to and from your heart all day long. The continuous transport system works all day and all night. When you're resting, when you're moving around, always. The lymphatic system, however, it's another tube-like system that runs throughout your entire body, except it doesn't have this engine, this huge pump like your heart to transport the fluid. The lymphatic system is completely passive. This means that you have to make it work. You have to make it work. And you do this when you contract your muscles. When you contract your muscles, the lymphatic vessels deep inside your body are squeezed, and the fluid within is forced to move. Think about this kind of like a cow being milked. You're squeezing things from one place to get to another. Swelling, therefore, is merely a buildup of waste around the injured area that needs to be evacuated through the lymphatic system. It's a natural response to injury that only becomes a problem when it's allowed to accumulate. When you see an athlete after they've sprained an ankle whose leg has ballooned to 2 or 3 times the size the following day, they don't have a swelling problem. They have an evacuation problem. They have a lymphatic system drainage problem. Ice does not facilitate clearance. It doesn't facilitate the clearance of swelling through the passive lymphatic system. While resting and icing might feel good in the short term, you're actually trapping debris around the injury and stunting the natural healing process from occurring. But what about the science? There has to be a research, study, or book or something to back up the use of ice. Wrong. For example, a 2011 study looked into the effects of ice after a muscle injury. One group received ice for 20 minutes following the injury, while the other group did not receive ice. The injuries were then closely followed for the next 28 days. The results were not what you would think. During the initial few hours following injury, it is common to see macrophages, aka those Pac-Man cleanup crew. It's common to see macrophages flood into the area. The researchers found several within the damaged muscle fibers of the non-icing group, the people that didn't ice. However, those who had been given ice showed almost no signs of macrophages, no signs of the things that clean up the debris. At 3 days post-injury, the no icing group already showed signs of regenerating muscle cells. Yet in the icing group, these cells were nowhere to be found. At 4 days out, Regenerated muscle cells were found in both groups, but those in the non-icing group were significantly larger than those in the icing group. And then at 28 days post-injury, a month after the injury occurred, the regenerating muscle of the no icing group was 65% larger than the icing group. 65% more regenerating muscle in the people that didn't ice as opposed to those that did ice. In addition, the researchers found significantly more scarring compared to the untreated muscles. So the authors of this study concluded, quote, "Judging from these findings, it might be better to avoid icing, although it has been widely used in sports medicine. Despite conventional wisdom that tells us that ice is a good idea, research shows that ice actually delays muscle repair after injury, giving us direct evidence that ice can ultimately lead to increased scarring," unquote. To make matters even worse, the way in which we use ice also has the potential for decreasing muscle strength and size, by using ice. Remember, the common protocol of rest, ice, compression, and elevation. When most people have an injury, they wrap a bag of ice tightly around the painful joint or muscle and stop moving that joint. We do this because we've always been told moving the injury will cause further damage. However, immobilizing your injury is actually doing more harm than good. When you stop moving for an extended period, your body does something. It responds by shutting down the essential process that regulates your muscle mass. It shuts it down. For example, previous studies have estimated that we can lose 0.5% of muscle per day, 0.5% of muscle per day, and up to 5% muscle in a week period. This shrinkage in muscle size is called disuse atrophy. And disuse atrophy is one of the major complications following severe injuries and those that require surgery. But what about directly after surgery? There's no way that you should move your stuff directly after surgery, right? There clearly has to be evidence that ice is helpful after that. Wrong. Studies on the use of ice to promote healing have shown little to no benefits at all. In 2005, researchers conducted a meta-analysis. This means a study of all the available studies. So in 2005, meta-analysis on the uses of cryotherapy directly after ACL reconstruction surgery. So those who just got ACL reconstruction surgery using cryotherapy directly after, they did a huge meta-analysis on these studies. They concluded that the only benefit was lowering pain. Icing did not improve how much the person could move their knee or lead to any decreases in swelling post-surgery. Swelling is no doubt a significant concern after surgery, especially those in lower bodies, such as ACL. When swelling builds in and around the area and remains, it can lead to a cascade of problems. It decreases our mobility long-term, it blunts our strength, and it increases our pain. These are all terrible stuff. But remember, icing does not help facilitate the pumping action of the passive lymphatic system, which is the only way to remove the swelling. And how do we do that? Movement. Author Gary Reinl, who helped write the book Icing, gave a great analogy on this concept. If you knew it was going to snow 2 inches every hour for the next 12 hours, what would you do on the doorstep of your house? You'd likely open the front door and brush off a small amount of snow with a broom every hour. But if you procrastinate and you wait until the end of the day, you'll open the door to find 24 inches of snow, and imagine how much more difficult it is to go grab a shovel and dig 2 feet of snow all out at once. Case in point, the reason swelling accumulates around an injured area of your body is because we stop moving. It's not because there's excessive swelling, but rather because we're doing nothing about the facilitation of lymphatic drainage to pull the swelling away. Instead of trying to block swelling from accumulating in the first place by icing, which clearly has other detrimental healing effects, We need to be proactive and work on improving the evacuation of the fluid and the waste so that it doesn't accumulate. No matter if you sustained a small injury like a sprained ankle, or you just got out of knee surgery to repair a torn meniscus, you need to turn your attention to evacuating the swelling, not preventing the swelling. But how do we facilitate this evacuation? Again, we move. Remember when you fell down as a child and your dad yelled, "Walk it off"? It's quite possible that your dad was right all along about keeping it moving after getting injured. Too quick do we instruct athletes to shut down completely after an ankle injury or a knee injury. Keep in mind, moving too much and too aggressively may and probably will make things worse. So there's a sweet spot, the Goldilocks zone here. Not too much, not too little. Too much is going to be detrimental to your recovery process. So we are proposing that we stop and we consider kicking off the healing process with as much light movement and active recovery as possible without pain. Discomfort is going to be there. Most definitely discomfort is going to be there, but doing our best to avoid the sharp pain. So, exercises performed in a relatively pain-free manner not only accelerate swelling removal through muscle contraction, but also optimizes the healing process without causing additional damage. Now, it might seem counterintuitive that we want to move in injury, but that's exactly the best thing that you should do. Loading damaged tissue with proper and appropriate exercises as soon as possible following injury actually accelerates healing of muscle and bone. The last thing you want to do is wait around and see how you feel tomorrow or the following day. Performing pain-free exercise following injury has countless benefits. To start, muscle contraction enhances the inflammation process by improving macrophage function, the cleanup crew, the Pac-Man. And it helps those amazing essential white blood cells to remove damaged cells. It also boosts muscle repair and regeneration, those last two parts of the healing process, and limits scar tissue formation through activation of muscle stem cells. Your muscle stem cells are called satellite cells. Satellite cells are amazing. Directly after an injury, the goal with movement is to facilitate healing without causing additional damage. Exercise too intensely and place too much load on the body, and you're only going to make it worse. This is why it's not a good idea to perform something like heavy back squats one day after spraining your ankle, or attempting to run 4 weeks after ACL reconstruction surgery. Those just aren't good ideas. But loading the body in a pain-free manner allows us to find the crossroads between efficient and safe recovery. That's what we're looking for here. The fastest, most efficient way to recovery in the safest way possible. One of the safest muscle contractions for acute injuries is what's called isometrics. Isometrics. You have a few different parts of a moving rep. And a repetition is like a movement, like a bicep curl or a squat. And you have the concentric part of the rep, you have the eccentric part of the rep, but the part that has the safest muscle contraction is called the isometric. An isometric describes the action of a muscle contraction without joint movement. So try this now. First, if you can, straighten out your knee all the way. Your leg goes all the way straight in front of you. Now, squeeze your quad muscle as hard as you can. Squeeze for 10 seconds. Hold it. Squeeze it as tightly as you can. Contract. Nothing's moving, but you're squeezing. And release. You just completed an isometric contraction for the quad muscle group. Now, in the early rehabilitation stages, like 1 to 4 weeks following an ACL reconstruction surgery, Dr. Horschig will often prescribe isometric quad sets to his patients' exercise programs. He does this to restore quad strength, to decrease pain levels, and guess what? Evacuate swelling. Yes, the smallest amount of muscle contractions can help remove swelling through the passive lymphatic system. It can prevent disuse atrophy, the muscle slowly atrophying, by increasing muscle protein synthesis. This is just helping you preserve muscle mass while you recover and build and create muscle, and then also decrease pain. This is why simple exercises like ankle pumps, if you've ever done ankle pumps when you've sprained your ankle, can be so helpful for athletes directly after getting that ankle sprain. Like post ankle sprain, I used to sprain my ankles all the time. I used to sit on my couch and write the alphabet in capital letters with my toes. So A, B, C, and I would take my ankle through all different ranges of motion. And then when I could do that with just my body weight pain-free, I would add a little bit of a band to it to add some resistance. And then I'd still do the ABCs. That was just one of the things that I did to help recover. As pain decreases, load should be increased. The amount of weight that you use should be increased to facilitate optimal healing. For someone with knee pain, this may mean progressing from starting with squats on a TRX or assisted somehow, then to bodyweight squats, from partial depth to full depth, and then eventually adding a load. The question always arises, what about those who cannot physically contract their muscles because of a significant weakness, or when weight-bearing exercises are limited due to post-op surgical precautions, or even like if you're in a cast? Well, while voluntary exercise is undoubtedly the most effective way to preserve muscle mass, it is also the best way to reduce swelling and kickstart the healing process after an injury. You can also do neuromuscular electrical stimulation devices. These devices come in a close second to the healing process. Neuromuscular electrical stimulation devices work by stimulating muscle contraction through electricity. You place these little electrode pads on your quad, you turn up the intensity, and suddenly your muscles will begin to contract and release all by themselves. Neuromuscular electrical stimulation devices have multiple uses that can be helpful for the athlete recovering from injury. One of the best known uses is the ability to reduce swelling. So by involuntarily stimulating this muscle contraction, these devices help pump excess fluid and waste out of the injured area through the passive lymphatic system. And they help dilate, make bigger blood vessels to bring nutrients and other helpful white blood cells to enhance the healing process. This is tough though, right? Because as most people, they don't want to move a painful area of their body. It's just like you feel a little bit of pain and you're like, yeah, I'm not going to move that. But swelling buildup, that creates even more pain and it leads to muscle atrophy. So this neuromuscular electrical stimulation has the ability to decrease symptoms and avoid loss of muscle mass, while at least in the early stages of recovery when maybe you wouldn't want to move that muscle or that joint. In fact, research has shown that a single session can increase muscle protein synthesis, the creation of muscle, by 27%. So from an injury, using these devices, increase muscle protein synthesis by 27%. That's crazy. The top neuromuscular electrical stimulation devices are the Mark Pro, the Complex, and the one that I personally use, the Power Dot. I personally own the Power Dot and I've used it for years and I absolutely love it. You might have actually seen me post on my social media stories, my muscles pulsing and contracting on their own after a particularly intense training session to help my recovery. The other great features of these devices is their ability to also eliminate pain through sensory modification. So this kind of helps. This allows the athlete recovering from severe injury or surgery to safely manage pain without having to rely on heavy narcotic medications. Simply put, after an injury, we want to promote movement, even if it's as little as a stimulated muscle contraction through one of these e-stim devices. And we do this in order to optimize healing and safely return to the sport that we love to perform, both efficiently and safely. So we've touched on how ice can hinder the natural healing process after small and large injuries. But what about using ice after something like an intense workout? Well, elite athletes around the world are always searching for the best techniques to accelerate recovery and gain an edge on their competition. In this continuous search, many swear by jumping in a cold bath or wrapping some ice packs across their legs, around their legs after heavy training. I've personally known many weightlifters who claim that ice baths are the only recovery technique that has allowed them to get through a high volume squat cycle. But what does the science say? When you have a hard workout, the muscles of your body sustain tiny amounts of what we call micro damage. This trauma sparks inflammation similar to what happens after an acute injury like a sprained ankle. The rush of inflammatory cells go to the site of the damage. They help to kickstart the recovery process by eliminating and getting rid of the damaged cells. They then recruit stem cells from surrounding tissues to help repair and regenerate new muscle cells, your satellite cells. If you comb through the available science on the use of ice after intense workouts, the main finding is that ice baths decrease your perception of muscle soreness by changing how your body senses pain. So it's kind of like masking the pain. And as far as the effect of ice baths after training on recovery of your performance for your next session, the research is kind of split here. Some studies show a 5 to 10 minute cold plunge can assist with performance during the next training session. And then some research studies say that it has no effect. A few studies even say that it can be detrimental. So research is split here. But here's Dr. Horschig's opinion. Periodic use of an ice bath may assist some athletes when they need to recover quickly for their performance being used the same day training sessions or competitions that are multiple competitions in a row. Maybe you have like a tournament or something like that where in 3 days you're playing 5 games. However, in the long term, regular use should be cautioned, as the continued use of ice can be harmful on the natural adaptation process for developing muscle strength and hypertrophy. So let's explain why. Why does ice hinder the process of developing muscle strength and muscle hypertrophy, which is just the size of your muscles? So if you want to get larger muscles or more quote unquote toned muscles, then ice would be detrimental here, is what they're saying. Muscle soreness and muscle fatigue are not the same things. While you may feel less sore after icing, you're not necessarily recovering any faster physiologically. Remember that there is a reason for your soreness. It's a normal reaction to intense training, just like the inflammation cycle is to an injury. However, the more accustomed an athlete is to a particular style of intensity of training, the quicker they naturally recover between sessions and the less soreness they will feel. This is why you feel so sore that you can barely stand up from a chair the first day following a high volume squat session or the first time you've worked out in years. However, the same workout 2 weeks from now, 2 weeks into the same training cycle, you don't feel nearly as sore following a similar workout intensity. Your body, it learns to adapt to the training stimulus. This is called the repeated bout effect. You are now stronger and more resilient to that intensity of training. This is why a majority of research on elite athletes has shown ice baths to not help at all with recovery and performance. In fact, multiple research articles have shown that ice will actually interfere with the normal adaptive responses to exercise that helps us recover and gain strength. Here's a direct quote from one such research article published in the Journal of Strength and Conditioning Research. Quote, "These data suggest that topical cooling, a commonly used clinical intervention, seems to not improve, but rather delay recovery from eccentric exercise-induced muscle damage," unquote. So unless you're looking for that instantaneous bounce back the day of a competition, you should be very cautious of the long-term effects of ice on recovery, especially when it comes to resistance training. If you're looking to get stronger, if you're looking to get bigger muscles, more toned muscles, when you really take time to look at the science, Using ice after a workout has the potential in long term to stunt the process for muscle growth and strength gains. Instead of reaching for that ice pack or jumping into a tub filled with ice, I recommend using an active recovery approach. This can involve going for a short 10-minute walk, performing a light workout of body weight stuff or banded stuff. Banded stuff is even better. It gets a pump to the muscle without really taxing it at all. Or even going for a swim or a bike ride, just something nice and light. Basically, getting off the couch and doing any non-fatiguing exercises that gets you or the body part moving and your blood and lymphatic system pumping. If you're extremely sore the day after an intense workout, I recommend performing a few minutes of soft tissue mobilization, so massage. Research has shown that a few minutes of something like rolling on a foam roller or a small lacrosse ball or tennis ball can significantly reduce delayed onset muscle soreness, or DOMS, or when you feel like a baby giraffe still after 2 days after the first leg workout you've done. So a little bit of massage can help if you have a really tough workout that day and the day after, and maybe even the day after. If you don't have time to get a light workout in, or you're feeling a little under the weather, try using one of these neuromuscular electrical stimulation devices like the Power Dot. These devices will mimic the muscle pump of active movement. The use of such devices delivers non-fatiguing muscle contraction without any effort that will then help the lymphatic drainage to remove all of that cellular metabolic waste that accumulates after heavy training and increases blood flow to stimulate the recovery and repair process. So, if you're doing daily doubles, to wrap this up, if you're doing daily doubles and you need to recover quickly before your second session, then ice or ice baths may be a great recovery aid for you. That would be the time to use it. If you're doing a lifting session to get bigger or to get more toned muscles, then it looks like the research says icing or ice baths or cryotherapy shortly after that workout session will hinder this process. Movement of the muscles of that area that were trained would be a better solution for recovery. So moving on to the final thoughts. If by now you still aren't convinced that the benefits of ice have completely been overblown and in most cases flat out wrong, I offer you one last piece of evidence. Every year, a group of authors who are experts in the treatment of acute injuries gather and comb over the current scientific literature and establish position statements for the National Athletic Trainers Association. So these experts, they all get together and they establish position statements for this entire association. And in 2013, they released one such statement on the recommended treatment for ankle sprains, an injury that is commonly addressed with the RICE protocol. After evaluating all of the available scientific literature on possible treatments for ankle sprains, they assigned ratings from the best rating of A to the worst rating of C, so A, B, or C. Do you know what rating icing your sprained ankles got? It got a big fat C, the worst rating. They even wrote that, quote, strong clinical evidence for advocating cryotherapy is limited, unquote. Do you know what the treatments they assigned a rating of A for were? Functional rehabilitation got the A. Functional rehabilitation is movement and getting that swelling down through active recovery. With this position statement, the profession that sees a majority of acute injuries among athletes acknowledge that icing is not as good as we all thought, and rather the best form of treatment is moving and then, when ready, loading the injured area through rehabilitation exercises. At the end of the day, our approach to treating injuries and soreness after training is quite simple. We want to get the good stuff in, white blood cells, and we want to get the bad stuff out, swelling that includes cellular debris and damaged tissue. I hope by now that you can see the entire process and all the mechanisms that go into completing this process and why this process is not optimized by using ice. After reading this article, I have a couple of takeaways, more than just the topic of rice protocol that I've used probably over 100 times on myself and that I've recommended to all my loved ones and clients that had injuries and that I found out is incorrect. But some takeaways that I got were sometimes the things that we all believe to be true are so much more nuanced. And had we not just believed blindly and actually looked at what the underlying mechanisms as to how these things actually work in our bodies and learn those things, we could then use the understanding of how it works to use it to our advantage and use it properly at the right times. Now that you know how ice works on an injury, you are able to decide that maybe it's good for this situation and not so good for that situation. And then also in the back of my head, I just can't stop thinking about how we always try to run away from pain. We always try to hide from what's uncomfortable. We always want to feel better right now. Why can't I just feel better now? What do I do to make myself feel better right now? Which more and more I'm seeing is just leading to more prolonged suffering and sometimes makes things worse in the end. It seems this is our strategy as a species. We just like to do it this way. I'm not sure if it's good or it's bad or what it will lead to. I'm not sure why we lean in that direction all the time, but it's something that I will be keeping in the front of my mind anytime that I encounter myself discomfort, pain, or feelings or things that make me want to change them immediately with quick fixes, with Band-Aids, with substances. So what did you learn? What did you get from all of this information? I'd love for you to share. Keep moving, team. Movement is life. And that's it, my friends, for this week's Megaphone episode. Each week, we're going to focus on sharing information that will help you with your health, fitness, and wellness journey. Share the knowledge that you gained today with your friends, your family, and hold each other accountable. If you enjoyed this content, it helps a ton if you could post on your social media stories a screenshot of this episode and maybe include one takeaway that you learned and make sure you tag me and share your journey. Tag me at livinthedream_podcast or at coachdamian_SD and let us know how this episode benefited you. Let's get more people on this lifelong learner train and join the Livin the Dream team. Message us if you have any suggestions or tips that will help your Livin the Dream team that we can discuss on future episodes. I will be right here with you, working on making us stronger, happier, and healthier humans. Until next time, friends, keep living the dream.